Of paramedicine and emergency medical services, or EMS systems, the role of the responder was to identify an individual who was ill or injured and rapidly transport the person to a facility, often called a scoop and swoop. Today, that has changed dramatically because of the expectations of communities and research findings. As a paramedic, you will encounter many different situations, from life threatening to simply lending an ear to a person who needs a listener. People you meet in the pre-hospital setting may evaluate you on what you see or what they see on television, read in published articles, or your treatment of a loved one. Remember that once you have completed your paramedic training and you are certified or licensed, you must not lose recognition that being a certified or licensed paramedic gives you the privilege, not the right, to treat somebody who is perhaps experiencing one of the worst moments of his or her life. Along with that privilege comes a responsibility to maintain your certification and continually upgrade your knowledge and skills. Paramedicine involves lifelong learning. Paramedicine is no longer considered to be in its infancy, but it continues to evolve. Modern-day paramedicine is a relatively new profession when compared with many other professions, such as nursing, for example. Way back in 1700 BCE in Babylon, the medical care professions went to the patient's home, or the medical professional, went to the patient's home, and the Code of Hammurabi, the king who invented rule by law, spelled out protocols and reimbursements for medical care, including punishment for malpractice. Sending the care provider to the patient was the way it was done until Napoleon's time. In the 1790s, Jean Larrey, a physician, developed des ambulances volantes, or flying ambulances. Care was brought to patients in the field as quickly as possible. So let's look at a case here. So you're dispatched to an episode of syncope at a local church. En route to the scene, the dispatcher informs you that your patient is an older woman who was reported by her family to have fainted during a church ceremony. She's now conscious and reports shortness of breath and lightheadedness. Her family believes she is just worn out and thinks that she should just go home and rest and she'll feel better. So let me ask you a couple of questions. First off, how is patient pre-hospital care initiated? And what do you believe the role that dispatchers play in the pre-hospital care? So it takes just a little bit of time to think about that. During World Wars I and II, battlefield corps, systems for field treatment and transport, continuously evolved as new techniques were learned that improved field care. In the 1950s and 1960s, paramedicine began to make major strides forward. In the 1950s, and especially during the Korean War, military medical researchers recognized that bringing hospital-type services closer to the field might give patients a better chance of survival. Helicopters, another new technology, brought patients to mobile army surgical hospitals, or MASH units, which helped thousands of soldiers and civilians survive. In the 1950s and early 1960s, however, the focus moved back to bring the hospital to the patient in some European countries. Mobile intensive care units, so MICUs, were staffed by specifically trained physicians, or specially trained physicians. The concept quickly spread to North America, but physicians were in short supply, and physicians who were interested had minimal expertise outside of the hospital. Physicians were then asked, can a person who is not a physician be trained to perform advanced medical skills? And many answered yes. In 1965, in the United States, the National Academy of Sciences and the National Research Council released a white paper entitled Accidental Death and Disability, the Neglected Disease of Modern Society, in which they outlined 10 critical points to establish a functioning system. So quickly going over the critical points of accidental death and disability. So the first one is to develop collaborative strategies to identify and address community health and safety issues. The second is to align the financial incentives of EMS and other healthcare providers and payers. The third is to participate in community-based prevention efforts. The fourth is develop and pursue a national EMS research agenda. The fifth is pass EMS legislation in each province to support innovation and integration. 6, to allocate adequate resources for medical direction. 7, develop information systems that link EMS across its continuum. 8, determine the costs and benefits of EMS to the community. 9, designate a single nationwide emergency telephone number. And 10, ensure all calls for emergency help are automatically accompanied by location identifying information. So, as a result, the National Highway Safety Act of 1966 was enacted. In this act, the U.S. Department of Transportation, the U.S. DOT or DOT, was created to provide authority and financial support for the development of basic and advanced life support. So, the first emergency medical technician textbook in the United States, Emergency Care and Transportation of the Sick and Injured, was published by the American Academy of Orthopedic Surgeons in 1971. In 1969, a year after basic standards were developed, Dr. Eugene Nagel, then of Miami, Florida, then began training firefighters from the Miami Fire Department with advanced medical skills. Dr. Nagel took the use of advanced emergency medical treatment one step further. He developed a telemetry system that enabled firefighters to transmit a patient's electrocardiogram to a physician at Jackson Memorial Hospital and to receive radio instructions from the physicians regarding what measures to take. Dr. Nagel is often called the father of paramedicine in the United States. Many cities set up individual advanced EMS trainings, and regions added their own spin to what they thought was the essential standard of pre-hospital care. But it was not until 1977 that the first national standard curriculum for paramedics was developed by the U.S. DOT. This first paramedic curriculum was based on the work of Dr. Nancy Caroline. So, the Canadian EMS has similar roots. The need for well-trained paramedics was initially identified in growing urban centers across the country. In Toronto, for instance, the first organized ambulance service hit the streets in 1832, mainly to transport victims of the cholera outbreak that had swept the city of York, as Toronto was then known. One of the first Canadian air ambulance programs was launched in Saskatchewan in 1946, following the success of the Royal Flying Doctors programs in the United Kingdom. Ambulance services in Canada were a combination of private, publicly funded, and volunteer services. The emphasis on formalizing EMS in Canada was tied to similar activities occurring in the United States. In British Columbia, an organized ambulance service was created in 1974 following government recommendations. The Canada Health Act, passed in 1984, is Canada's federal legislation that funds healthcare insurance using public funds. The Act's 5 principles are public administration, accessibility, comprehensiveness, universality, and portability. The responsibility for service lies with the provinces and territories, with accountability to the federal government. Paramedic and ambulance services are not hospital-based services and are therefore not included in the funding provided by the Act. The provinces and territories differ in their approach to funding paramedic services. In Canada, the paramedic profession has evolved from the earliest days when ambulance drivers simply transported patients to the hospital, to today's professionals who provide a range of medications and therapies to aid those who need early and immediate intervention. The early 1990s saw paramedic training programs included in the Canadian Medical Association accreditation process. Accreditation of Canada's paramedicine training programs is now the responsibility of Accreditation Canada. The Paramedic Association of Canada, also known as the PAC, formerly the Canadian Society of Ambulance Personnel, is Canada's organization representing pre-hospital practitioners. The association was formed in 1984 and currently represents over 20,000 practitioners located in many provincial chapters and the Canadian Armed Forces. Now, in 2001, the Paramedic Association of Canada issued the National Occupational Competency Profiles, also known as the NOCPs, for paramedics. This landmark document was the first to describe the core competencies that paramedics are required to master practice in Canada. The 2001 NOCP was reviewed and refined to produce an updated profile. The review process for the subsequent update of the NOCP began in 2006 at a Future Vision conference and culminated in 2011 with an agreement between the Canadian Organization of Paramedic Regulators and the PAC to adopt the 2011 National Occupational Competency Profile as a foundational document in the development of a national examination for paramedics. With services provided and coordinated from such a broad base of sources, the challenge is to find common ground for coordinated activities. Factionalized EMS provider groups have been challenged to work together and to provide a credible national voice to be heard across the country at all levels of government. The Paramedic Chiefs of Canada, PCC, was incorporated in 2002 as a national forum for informing, gathering, policy development, and coordinated action by the leadership of Canada's paramedic systems. You can go to their website at www.paramedicchiefs.ca. So if you go to that website, it's a membership that draws from all the types of EMS systems, the Paramedic Chiefs of Canada is a membership that draws from all types of EMS systems across the country, with voting membership open to those who operate EMS systems, whether large or small. Associate membership is available to those who operate within EMS systems in a supervisory or managerial capacity, but who are not the senior officers of the respective services. The PCC envisions Canadian EMS as a mobile healthcare service existing in the center of the community, reaching into many aspects of community life and community services. The PCC, in its white paper, The Future of EMS in Canada, Defining the New Road Ahead, 2007, defined a national strategy for EMS, which embraces 6 key strategic directions. The first of that being clear core identity, so define who and what EMS is clearly and consistently. 2, stable funding, ensure the consistent availability of those community resources that are required to provide high quality EMS services. Systematic improvement, so the EMS system must be open to change and directly accountable for performance in a complex and ever-changing environment. It is not enough to say that EMS is doing a good job. EMS must be prepared to prove this regularly, consistently, and transparently. Personal development. Paramedics are one of those rare and wonderful groups for whom learning never stops. EMS must ensure that both education and training of staff are sufficiently robust to enable both personal and professional growth for paramedics, as well as the highest quality of pre-hospital care, embracing all new and appropriate technologies to provide the maximum medical benefit to each patient. Leadership support. Just as paramedics must undergo training before serving in an ambulance, those responsible for the day-to-day operations and planning of each EMS system must have the specific knowledge and skill sets necessary to operate an EMS system and maximize performance. Mobilize healthcare. As healthcare in Canada changes and evolves, EMS must change and evolve along with it. There are increasing numbers of places in the world where both the role, the scope of practice of paramedics have evolved to provide definitive primary care outside of traditional clinical venues. Paramedic practitioners have the knowledge and skills required to provide such care. So this collective approach to the fostering of high-quality EMS in Canada has already met with considerable success. A national forum for EMS has been created along with a highly credible national voice of EMS, which is beginning to influence all levels of government in ways that were not possible nearly a decade ago. Of course, this doesn't come without controversies. So many communities initially fought against ambulance drivers playing doctor, quote unquote, or in other words, becoming paramedics. Now, even the smallest communities expect to access ALS or advanced life support trained personnel. So going back to our case study, so as you perform a focused history and physical exam, your partner takes the patient's vital signs. Her pulse rate and blood pressure concern you, and you apply the cardiac monitor. As you question the patient and her family about her medical history and events that have occurred during today's festivities, you immediately note an arrhythmia. So here's a question for you. What pre-hospital care can primary care paramedics provide for this patient? Just from your basic knowledge right now. So take a couple of seconds to just think about this. So the EMS system. Today's paramedic system is a complex network of coordinated services providing various levels of pre-hospital care to a community. These services work in union to meet both the growing and standing needs of the citizens in the community in which they reside. As a paramedic, you are part of this network. Therefore, you must stay active in your community to be able to meet the ever-changing needs. The paramedic network begins with citizens' involvement in this complex system. The public needs to be taught how to recognize that an emergency exists, how to activate the EMS system, and how basic care can be provided before paramedics arrive. Remember that the public's idea of an emergency may be dramatically different from yours. When you're called to a sick person at 2 o'clock in the morning who only has a common cold and cannot sleep, avoid becoming angry at the patient. Your career or your paramedic system, this is something that will happen often, and it's just part of the role of the paramedic. Again, we get into this field because we're excited to provide care to the severely traumatized patient or somebody who's having a stroke or a heart attack. But no, we are part of the healthcare continuum. We are there to treat any and all patients, no matter how trivial their symptoms may be. So in your education, you will find that there are many general symptoms that could cause you to overlook a serious problem. Remember, you are a public servant. You will often respond to non-emergent calls. When the public activates the EMS system, their first contact is usually a dispatcher. Requirements for dispatcher training varies greatly from province to province. Dispatchers must interpret the caller's needs in an emergency and extract appropriate information. Scene findings do not always exactly reflect the information received by dispatch and relayed to you. Regardless, you will begin to develop your pre-hospital care plan for the patient and decide on the appropriate transport method and receiving facility for your patient based on this information. Being active in your community keeps you on top of the best local resources, enables you to answer questions regarding your patient care plan. Ask yourself, does the receiving facility have the resources needed for this patient? If the answer is no, the next question may be, is there an appropriate facility within a reasonable distance? There are currently several levels of providers in the EMS system. Each level has a scope of practice as outlined by the NOCPs. The scope of practice is reevaluated from time to time and may change as a result. Canada's paramedic training programs have an international reputation for producing practitioners who are not only highly skilled, but who also possess a significant level of clinical acumen and critical thinking ability. So let's take a look at all these various levels. Starting with the dispatcher. The dispatcher plays a role in the emergency call. He or she must receive and enter all information on the call, interpret the information, and in turn, relay it to the appropriate resources. In some locations, the dispatcher may be formally trained as an emergency medical dispatcher. This person will have the added task of giving simple pre-arrival instructions, for example, CPR or bleeding control, etc., to a caller in hopes that this care may benefit the patient until paramedics arrive on scene. In larger services, the traditional dispatch role is divided into call taking and dispatching, with the former role taking calls and determining the caller's needs, and the latter communicating with frontline crews and allocating resources. The emergency medical responder. Not all provinces and territories have this as a certification, and for those that do, there can be considerable variability in requirements. In the generic rule use of the term, an emergency medical responder, also known as a first responder, is a person trained in CPR and or first aid, often working as part of first response agency such as a fire service or other community-based public service agency. As a paramedic, one of your jobs will be to familiar yourself with the level of training of first responders in your system. The primary care paramedic. In most Canadian regions, the PCP is the backbone of a primary provider level in many paramedic systems. PCPs provide care and transport for the entire spectrum of patients encountered by any system. In addition to oxygen, wound care, splinting, and other basic treatment modalities, PCPs in Canada, in most of Canada anyways, can administer a select number of medications for the treatment of common symptoms, such as ischemic chest pain, shortness of breath. PCPs can also defibrillate unstable cardiac rhythms using manual and automated defibrillators, and in some cases provide advanced airway procedures using supraglottic airways. Additionally, some PCPs can initiate or maintain intravenous lines and provide certain types of fluid therapies. So next we have the advanced care paramedic, also known as ACP, which builds on the knowledge and skills of the PCP. In Canada, ACPs provide what is traditionally considered ALS, or advanced life support. ACPs can provide specific airway measures, including intubation, cricothyrotomy, and needle decompression. The ACP medication list includes a variety of medications to manage cardiac, respiratory, neurologic, and endocrine emergencies. So lastly, we have the critical care paramedic, or the CCP. So critical care paramedics, CCPs, are a unique group of medical practitioners who work primarily in the delivery of air ambulance or land-based critical care interfacility transfer services. Many of the patients managed by these highly trained professionals are complex in nature, often requiring multiple medications, blood products, and mechanical ventilation. Although CCPs participate in the emergency responses to accident scenes, their primary role is to move critically ill patients between facilities. They may also collaborate with hospital-based teams to carry out transfers of patients requiring highly specialized therapies, such as extracorporeal life support, also known as extracorporeal membrane oxygenation. For all paramedics in Canada, one of the most important roles that has emerged over the last few years is the responsibility to recognize patients who need specialized care at designated hospitals. These include patients with acute myocardial injuries, stroke, trauma, pediatric emergencies, and burns. Future directions for Canadian paramedics includes mobile healthcare and community-based programs, providing transport of patients to destinations other than hospitals, and using treat and release options for patients who do not require service beyond what the paramedic can provide. Finally, paramedic services will also become increasingly recognized by and integrated into regional healthcare systems, serving as a valuable resource for the community's primary and preventative care needs. So looking at paramedic education, so the initial education. Education may vary from province to province, but in most cases, provinces and territories base their paramedic education programs on the NOCPs. Of course, here in Quebec, that we also have to follow what's called the MES, or the MEES. Most PCPs receive their initial training at the community college, or again here, a similar academic institution, such as a CEGEP, which is your case. This typically, but not always, occurs before the paramedic student is hired by a paramedic service. Program lengths vary from less than 1 year in British Columbia to programs like some here in Quebec that run 3 years and sometimes longer. ACPs are also trained at the community college level. Many seeking ACP level training are already employed as PCPs when they enter training. Service-based training programs are not uncommon. ACP programs tend to range from 1 to 2 years in length. There are very few accredited CCP programs in Canada, and they are almost entirely operated through air ambulance programs. Regardless of the program length or paramedic type, the key measure for any educational program is quality. In Canada, paramedic training programs are accredited by Accreditation Canada after the program demonstrates that it meets minimum standards based on the NOCPs. The future of paramedic education will include university-based training programs at the bachelor level, similar to what is already present for other allied healthcare professionals, again, such as registered nurses. So continuing education. Most provinces require paramedics to show proof of hours spent in continuing education programs. Such programs keep you updated on new research findings and new techniques and skills, and help prevent degradation of skills used less frequently. So last that I checked, in Quebec, it should be around 31 to 32 hours per year. Continuing education can also showcase current issues in your province that impact you and your system's ability to provide quality emergency care. Continuing education can be enjoyable, and it should be. Whenever possible, you should attend conferences and seminars, ideally with some of them being out of your region and or province, which helps broaden your knowledge base. Consider attending conferences that may not be designated specifically for paramedics. Another way to broaden your knowledge base is to read paramedicine and emergency medicine journals, or to attend a journal club. Finally, internet-based continuing education resources are another great option. However, be sure that these programs meet your provincial requirements. Get everyone on your service involved in post-call reviews. They can be beneficial in identifying problem areas in your practice. No matter what requirements are mandated by your provincial regulators, responsibility for continuing medical education ultimately rests with you. You know which areas of your knowledge have diminished and which skills require additional refresher of sorts. So you are the person who will have to live with the questions and doubts that inevitably arise after something goes really wrong in the field. Continuing medical education is a way to help ensure you're following the latest best practices and build confidence in your skills. So here's our case continued. Your paramedic partner asks the patient whether she has any allergies to medications and then administers an appropriate dose of Versed for sedation. You simultaneously prepare your equipment for synchronized cardioversion and explain to the patient that you must do and what she should expect. You advise the other responders to be prepared for deterioration of the patient's condition and to notify the receiving facility of her condition and the treatment she has received. So what are the advantages of having a partner? And is there one team member who is more important? So take a few seconds just to think about this. So many national and provincial organizations exist, and many invite paramedic membership. These organizations affect the future direction of paramedicine, so it's important for you to become involved in them. You will also have access to many valuable resources to help you develop yourself and your service area, and to improve your problem-solving skills. One of the common goals of many national organizations is to promote uniformity of EMS standards and practices. Some of these organizations are, for example, the Paramedic Association of Canada, the Paramedic Chiefs of Canada, that which we've talked about, but there's also the Society for Pre-Hospital Educators in Canada, the Canadian Transport Medicine Association, the Canadian Association of Emergency Physicians, and the Heart and Stroke Foundation. On completing a paramedic training program, you will be required to be registered, licensed, and or certified to practice your profession. So here you will be registered. Performing functions as a paramedic prior to this is unlawful. To be more specific, it is considered practicing medicine without a license. Provincial, regional, or local guidelines determine your status when you complete your paramedic training. There are subtle differences between licensure, registration, and certification, which are discussed in the chapter 4 of your book, Medical and Legal Issues, and you'll learn this in another course. Throughout this chapter, to avoid repetition, when we talk about being certified, it means the same as holding a license. Although being certified or registered shows that you have successfully completed a training program and met the provincial requirements to achieve such a license, it does not mean that you can perform as a paramedic without the supervision of your service's physician medical director. So medical direction plays a role in delegating medical acts to paramedics. The extent of a role in delegating and the relationship is dependent on the different jurisdictions, service, and agreement with the delegated physician. Although legislation and regulations vary across Canada, paramedics should be well versed in the legislation and regulation that apply to them. The specific concepts and principles of medical direction or direct medical control will be discussed later as we go through this presentation. Finally, you may be required to be registered as well as licensed. Registration means that records of your training, local licensure, and recertification will be held by a recognized board of registration and implies that you have successfully completed the required provincial testing. Additionally, some provinces require that paramedic graduates come from an accredited paramedic program. Accreditation Canada is the only common or only national accreditation agency for paramedic training programs across Canada. So, discussing reciprocity, it's important to be aware that each province has different registrations, certification, and licensing requirements and procedures. Granting recognition to a paramedic from another province or agency is known as reciprocity. This process differs from province to province, and in some cases you simply need to be in good standing in your current province to qualify, whereas some provinces require you to challenge the requirements. In other words, you may be required to go through that province's written and or practical evaluations prior to reciprocity being granted. Others may request your training program transcripts and continuing education hours. Discussing professionalism. So during your paramedic education and training process, you learn a vast amount of information designed to make you a healthcare professional practicing at the paramedic level. A profession is a field of endeavor that requires a specialized set of knowledge, skills, and expertise, often gained after a lengthy training. As a paramedic, you will be trained at length for certification with standards, competencies, and continuing education requirements. A paramedic is considered a healthcare professional. A healthcare professional has the following attributes. So they conform to the same standards of other healthcare professions, they provide quality patient care, instill pride in the profession, strive continuously for high standards, earn respect from others in the profession, and meet societal expectations of the profession, whether on or off duty. As a paramedic, you will be trained for certification using standards, competencies, and continuing education requirements. The paramedic profession has expected standards and performance parameters, as well as a code of ethics. Collectively, these are all the standards by which you will be measured as a paramedic. It's imperative that you remember you are highly visible in your role in your community. Professional image and behavior must be top priority. You represent the agency, your city, the province, or the territory that you work in. It is said people will make an initial judgment of you within the first 10 seconds of meeting you. You will meet new people every day as part of your career. To provide the best possible care, you must instill confidence, plus establish and maintain credibility. As you walk into a situation, remember that a big part of your job is to continuously show your concern for the well-being of your patient and their families. Your appearance is also of the utmost importance. It has greater effect than you may even think. It is not appropriate to arrive at a call in dirty clothes, dirty hands, smelling offensively, your shirt untucked. You have to look professional at all times. Other attributes of professionalism as a paramedic include the following. So, looking at these 4 points right now is integrity, the single most important attribute. So, be open, honest, and truthful with your patients. Empathy, show your patient, their families, and other healthcare professionals that you identify and understand their feeling. Self-motivation, have an internal drive for excellence, which is often a driving force to ensure that you always behave in a professional manner. Continuously educate yourself, accept constructive feedback, and perform with minimal supervision. Communication, express and exchange your ideas, thoughts, and findings with other professional colleagues. Make conscientious reminders to yourself when interacting with patients and their families to listen well, speak directly without using confusing medical terms. Teamwork and respect. Teamwork is required in EMS. On every call, everyone involved must work together to achieve a common goal to provide the best possible pre-hospital care to ensure the overall well-being of your patient. Most often in the pre-hospital setting, the paramedic is the team leader. A team leader will not undermine his or her team, but instead will help guide and support the team, remaining flexible and open for change at any moment and communicating at an appropriate place and time with other members of the team to resolve any problems. Always be as respectful of others as you would expect them to be of you. Patient advocacy. So act in the best interest of the patient while respecting his or her wishes and beliefs, regardless of your own. This includes patients with special needs or those with different lifestyles, values, and cultures from your own. Never allow your personal feelings about a patient to have an effect on the pre-hospital care that you provide. Respect those that you serve. Although you need to communicate to do your job, be sure that you maintain a high level of confidentiality. Do your best not to talk in front of anyone who is not on your team. When you talk to members of your team, do so in private and with appropriate respect. Your role in patient advocacy means that you should always be on the lookout for spousal abuse, child abuse or neglect, and elder abuse or neglect. If abuse is suspected, report and communicate your findings to the appropriate authorities. Next, let's talk about injury prevention. A paramedic is the unique position of seeing the patient's surroundings prior to transport. If you spot a potential hazard, such as a loose rug at the top of the stairs, use your diplomatic skills and talk about your findings to the patient or a family member. You may prevent a potential injury. Discuss the importance of using bike helmets, safety belts, and child car seats whenever you can. It's another way of preventing injuries. Careful delivery of service. You must deliver the highest quality pre-hospital care and pay careful attention to detail and continuously evaluate and reevaluate your performance. Use other medical professionals as your resources, not your adversaries. Follow policies, protocols, and procedures, as well as the orders of your superiors. Now let's discuss our roles and responsibilities. So what does it actually mean to be a paramedic? What are your roles? What are you responsible for? These are questions that you should ask yourself throughout your career. Paramedicine continues to grow and mature, and with changes comes new roles and additional responsibilities. Some of the primary responsibilities are, for example, preparation, so being prepared physically, mentally, and emotionally. Keeping up your knowledge and skills and abilities. Ensure that you have the appropriate equipment for your call and that it is in good working order. Response. So responding to an event in a timely, safe manner is very important. Driving at high speeds with lights and sirens on without due regard to your own safety or the safety of your partner, your patient, and persons on the highway, even if they should get out of the way but they don't, it's just not acceptable. You're not going to go injure one person while you're trying to go help somebody else. Scene management. Your first priority is to ensure your own safety and the safety of your team. Then you must ensure the safety of your patient and any bystanders. Part of your preparation before you reach the scene should include assessing the situation. The nature of the call will give you a lot of valuable information. Preparing for scene safety starts with the use of personal protective equipment such as gloves, masks, or goggles. You set the example for safety to the members of your team. And trust me, you will encounter this where people will slack off a little bit with their personal protective equipment. Be the paramedic that will lead by example. Patient assessment and scene care. So, perform an organized assessment of each patient based on the principles you will learn throughout this program. Recognize and prioritize the patient's needs on the basis of injuries and illness most in need of urgent treatment. Management and disposition. So it's important to follow protocols signed off by the medical director. Sometimes, however, when you're in the pre-hospital environment, you will discover that the protocols might not cover the situation that you're actually in. This is the time when you must contact your medical director or direct medical control for orders. Having a good working relationship with your medical director and direct medical control is critical. You're in the eyes, the ears, and the touch of the medical director. So situations that require variance of protocol or decision outside of your scope of practice need to be communicated with your medical director. You must also make the appropriate transport and destination decisions, often with the cooperation of other medical professionals. Know the capabilities of all receiving facilities with which you may interact. This will assist you in making the right decisions for your patient. Transferring care. Once you arrive at the receiving facility, continue to act as a patient advocate and give the appropriate facility staff a brief, concise handoff report. Once again, use discretion so you protect your patient's privacy. After you transfer the patient, it's extremely important that a patient care report be filled out immediately. The report serves as a legal record of what you did in the pre-hospital environment. Physicians must document their care of the patient. So must you. Guidelines for documenting will be covered throughout this program, of course. Every person on the EMS team is responsible for restocking and preparing the unit as quickly as possible for the next call. Failure to do so can bring about nasty legal consequences if another call comes in and the unit is not fully restocked and ready to respond. You are looked on as a healthcare professional, so take advantage of that situation. Educate the public about what you can do and its importance. Get involved with prevention, community, and leadership activities whenever possible. Never miss an opportunity to teach the community about prevention of injury and illness. Explain to people how to appropriately use your services. For those areas where trained paramedics are few and far in between, use your abilities to promote programs that get the public involved in CPR, one of the major determinants of whether a person in cardiac arrest will live or die. In some regions, paramedics have other healthcare responsibilities, such as working in the community clinics, freestanding emergency facilities, and hospitals. Home visits by paramedics under direct medical control are also occurring in many parts of the country. Paramedics of all levels need to be advocates for pre-hospital healthcare, which often means setting out a well-thought-out campaign for EMS. Research your community, look at the strengths and weaknesses of the system, and develop plans for initiatives to improve the system. Many people lack the understanding of a paramedic's job and recognition of how vital it is when a loved one unexpectedly becomes ill. Many programs on television today give the public only a very small insight into the true world of paramedicine. By involving yourself in your community, you can both educate and advocate. It is up to all paramedics to educate the media and public. Continue your education, become a mentor for a new paramedic, and conduct research activities. So our case continued. Your patient's pulse has decreased, blood pressure has increased, and she no longer feels short of breath or lightheaded. Her skin signs are much improved. Your paramedic partner administers lidocaine, and your patient and her entire family thank you and your partner in the emergency department for your help. So here's 2 more questions to reflect on. Why is it important to keep skills current? And why is it important to practice these skills as a team? One of the distinctions among levels of paramedics are the number and types of acts that can be delegated to any given paramedic. These acts, such as a procedure or administration of a medication, are typically performed only by physicians or other advanced practitioners. However, the legislation and regulations governing paramedicine may not give the paramedic independent authority to act. In the past decade, physicians taking on the role of medical director are increasingly well-versed in pre-hospital care. The Royal College of Physicians and Surgeons recognized pre-hospital and transport medicine as a formal discipline in 2017, which is not that long ago, with competencies and formal training requirements to meet the growing medical leadership needs of paramedic services in Canada. The medical director or designate also provides direct, either by radio, telephone, or other forms of electronic communication, and indirect medical control. Direct medical control provides immediate and specific care and allows, for example, telemetry transmissions, allows for real-time assessment of quality, and can render on-scene assistance. Indirect medical control allows for the development of protocols, standing orders, procedures, quality improvement, and training. A protocol is a treatment plan for a specific illness or injury. A standing order is a type of protocol that is a written document signed by the service's medical director and outlines specific directions, permissions, and sometimes prohibitions regarding pre-hospital care that is rendered prior to contacting medical direction. For example, defibrillation. Protocols are usually developed in conjunction with the national standards. For example, EMS personnel use the Heart and Stroke Foundation of Canada advanced cardiac life support algorithms as a protocol for cardiac patients. Protocols also indicate what types of equipment and supplies are approved and needed, as well as minimum expectations of personnel. A step beyond standing orders is a clinical practice guideline, or CPG. When treating patients, paramedics are often faced with difficult decisions and uncertainty because not every patient fits the medical directive or standing order. CPGs are statements that include recommendations designed to provide optimal care. CPGs are less rigid and prescriptive than a standing order. They depend on the paramedic's ability to select which aspects of the CPG are appropriate for the particular patient, taking into account the patient's condition and other environmental factors. Use of CPGs depend on critical thinking skills and sound decision-making. While more flexible than a protocol, a CPG requires skilled, knowledgeable practitioners to be effective. The medical director also plays a role after the ambulance call. Medical directors review patient care reports and are actively involved in continuous quality initiatives aimed at refining and improving care. Making a good thing better should always be part of your paramedic career. A tool often used to continually evaluate your pre-hospital care is called Continuous Quality Improvement, CQI. Quality assurance is another process that evaluates problems and finds solutions. CQI is a process of assessing current practices and looking for ways to create ongoing improvement, thus reducing the chance for a problem to arise in the first place. When properly developed and followed, a CQI program can help you and your service. The process of CQI is dynamic, and your paramedic system should develop a structure before a CQI assessment program is started. A good CQI process should include the following: identify any system-wide problems, conduct an in-depth review of the issues, evaluate the issues and develop a list of remedies, develop an action plan for correction of the issues, enforce the plan of action, including timeframes, re-examine the issue, identify and promote excellence found in patient care during the evaluation, identify modifications that may be needed to, any modifications needed for protocols and or standing orders. Identify situations that are currently not addressed by protocols and standing orders. Although it may not always be feasible, all ambulance calls should be reviewed. Ultimately, the focus of CQI needs to be on improving patient care. Many services will choose to do quality assurance as a peer review. Peer review can be a good learning experience if the people performing the review have proper and consistent guidelines to follow and keep an open mind. No matter how good your education and training, you will still make mistakes and miss things from time to time. When a peer reviewer finds things you can improve, you should look at it as an educational tool. In an ideal system, the members of the peer review team rotate on and off, meaning that you at some point in time will also serve as a reviewer yourself. So some caution: never use this process as a tool to demean or belittle a fellow paramedic, nor should you discuss your findings with anyone who is not identified as part of the review process. It's important to be professional. A comprehensive CQI program can help to prevent problems from arising by evaluating the day-to-day operations and identifying possible stress points in these operations. These may include things such as medical direction issues, training and education, communications, pre-hospital treatment, transportation issues, financial issues, receiving facility review, dispatch, public information and education, disaster planning, and mutual aid. As a professional, you're responsible for reporting adverse events or near misses to the appropriate authority to improve the system and as part of the personal improvement and remediation cycle. Additionally, paramedics are becoming involved in error disclosure processes in many provinces where paramedics, medical directors, and support staff meet with patients and families to discuss errors and other patient care concerns. So today we've covered the EMS system. We looked at paramedic education. We discussed the roles and responsibilities of the paramedic, and we talked about improving the system quality. Now, going back to the summary, let me just discuss kind of some of the answers that we were looking for. Starting with the first question, which was, how is patient pre-hospital care initiated for the call, specifically our case that we had, or any other call? So pre-hospital care most often comes with a phone call to 911, or if the 911 system does not exist in whatever area that we're working, with a call to the police or fire department. Of course, that's not the case here in Quebec. Educational programs provided by the local fire and EMS agencies are vital in guiding the public on how to recognize an emergency, how to access emergency services, and how to provide basic first aid, including CPR, the use of an AED or an automated external defibrillator. And it's important that if the specific community you end up working with doesn't have a specific outreach program, then maybe you should start thinking about being the person who initiates that. So what's the role of the dispatchers was the second question that we had asked. And without dispatchers, appropriate medical, fire, and police resources would not be allocated properly. So dispatchers are extremely skilled professionals who are able to calm callers, gather pertinent information regarding the location and nature of the incident, and provide pre-arrival instructions to the caller over the phone. So they are part of that chain. All of those actions are essential in providing pre-hospital care to the sick and injured. Third question was, what pre-hospital care can primary care paramedics provide to this patient? So as a PCP, we can provide essential life-saving pre-hospital care by administering oxygen, splinting, controlling bleeding, providing CPR, using AEDs, using monitor defibrillators, and of course, depending on, even the timing of watching this video, but we can have expanded scopes of practice that allow for a broader range of skills depending really on where you are working. So the fourth question was, what are the advantages of having a paramedic partner? So depending on which areas that you're going to work on, some systems provide ALS trained paramedics while others don't. So having an ALS trained partner is especially helpful when you first begin your career. Some days you will notice that finding a vein for an IV line and opening an airway for a tube are a lot more difficult, even for the most seasoned paramedic. Having an ALS partner is especially advantageous because your partner can assist and serve as a sounding board for your ideas and concerns. It's also important to note that not all systems run ambulances with 2 ALS paramedics. Instead, your team may only include 1 ALS trained paramedic, which can happen. If you're a double BLS crew with a double ALS on another crew, you might switch so that the highest level or that specific ambulance will be able to provide the highest level of care, which is what the community deserves. Next question was, is there one team member who is more important than another? And no, it's a very clear answer. No team member is more important than the other. It's very important to treat all team members with respect, no matter what their skill level. They are all essential in providing quality pre-hospital care. You might be the most highly trained person on the scene, but you must remember your professional demeanor, which includes good manners. Providing quality pre-hospital care is a team effort, and it serves us well to remember that our purpose to provide the best pre-hospital care possible. That's our goal. And in the end, if we do get our act together, only one person pays the true price, and that's the patient that we are committed to serving. Next was, why is it important to keep skills and knowledge current? So one of the challenging aspects of being a paramedic is that it's an ever-changing field, and medical research projects track positive and negative impacts of pre-hospital care. And as technology changes and more information is assessed about using medications, applying patient care techniques, the treatment that you're going to be doing in the pre-hospital environment will continue to change and improve. So it's important to stay up to date. And lastly was, why is it important to practice these skills as a team? So, because teamwork is an essential element of emergency medicine, it's extremely important to practice working as a team, as each member already knows what's expected of them to meet the patient's needs, and the most effective and efficient pre-hospital care becomes. So, an efficient team working together will boost the image of the service in the opinion of the patient and the patient's family members and the public.